Good morning, Mrs. Smith. I am Anna PSW for today. Today I'm going to help you with your complete bed bath. Um, can I confirm your identity? Mrs. Smith, can you please tell me your complete name and birthday? Thank you. Mrs. Smith, do you want me to bring the bedpan before we start the procedure? Thank you. I'm going to prepare all the supplies and I'll be right back. Assuming I already gathered all the supplies and I provided the privacy by closing the door and the windows, and I also do the proper hand washing for about 20 seconds, and now I'm going to start. I'm going to raise the bed to my waist or my comfortable working height, and then I will lower the bedroll nearest to me, and then I will put the bath towel. I will put the bath towel on Mrs. Smith's chest, and I'm going to Mrs. Smith, I'm going to lower the head of the bed. Can you please tell me when to stop? Thank you. And now I'm going to raise the bedroll nearest to me. I'm going to prepare the water. I got 2/3 water in the basin, and I checked the temperature using the thermometer as facility policy, and I can also use my elbow, the tip of my elbow, and then now I'm going to put on the overhead bedside table. I'm going to lower the bedroll and I'm going to start. Using a bath cloth, I'll make a mat this corner, and then I will use this to clean Mrs. Smith eyes first. I only use water with the washcloth, and I will use I'll start the eye part is for me, and I will start with the inner eye to the outer eye. And now I'm going to wash Mrs. Smith's face. Mrs. Smith, do you want me to use the soap in washing your face? Thank you. So I already put the wash soap, and then in a clean corner, I'm going to make a mitt again. So now I'm going to wash Mrs. Smith's face. Starting the side part is for me, and then to the nearest side to me, and then the neck, and then the ears too. Now I finished washing Mrs. Smith's face, eyes, ears, and neck. I rinsed them already. I rinsed them thoroughly, and then now I'm going to dry them using the towel on her chest. So now I'm going to help Mrs. Smith to wash her arms, shoulder, and her hands. So I'm going to put the towel on Mrs. Smith lengthwise, and then assuring that I will not uncover the part of the body which is I'm not working with. So I'm going to put a bath towel under Mrs. Smith under Mrs. Smith arms. This is for if there is water dripping, it will not go directly to the bed sheets. And now I'm going to use a clean washcloth, and I will meet the meat again with the soap. I'm going to start washing Mrs. Smith's arm away from me, and I use the long firm stroke. And then if I see that her hand is visibly soaked, I will soak in the water for about 3 to 5 minutes, and then I will use the orange stick to clean under nails. And then I will rinse thoroughly and then gently pat dry, and I'll do my observation, especially the bony prominence, if there is any redness in color, or if there is a sign of pressure ulcer or there is skin abnormalities. And now I am finished with the farthest arm and hand away from me. I'm going to transfer the towel on the hand close to me and the arm, and now I'm going to do the same procedure. I'm going to wash Mrs. Smith's arms with a firm long stroke, and then I soak her hands for about 3 to 5 minutes, and then I use the orange stick to clean under nails to remove those dried foot or pieces. And then I wash I rinse thoroughly, and then I gently pat dry, and I apply moisturizer. Now I check the water temperature if it is still warm. If it is cold, then I need to change the water, and then I need to raise the bed rail, and then I'll change the water. So assuming I changed the water already, I checked temperature using the thermometer, and now I'm ready to wash Mrs. Smith's chest. I'm going to put the bath towel across Mrs. Smith's chest, and then I will pull gently the bath blanket, ensuring that I will not expose Mrs. Smith's pubic area. So I should pull the blanket to her waist level, and then now I'm going to wash Mrs. Smith's chest by using the water and soap. I'll make a mitt with a clean washcloth, and I'll slightly lift the towel and slowly wash or gently wash Mrs. Smith's chest, making sure that I will not expose the other area which I'm not working with. At the same time, I will check Mrs. Smith's chest if there is any redness of the color, or the pale, or the white, or any abnormalities, or the swelling, or drainage, and then if there is, I will make sure to record and report to the supervisor. And then after I wash Mrs. Smith's chest, I will use a clean washcloth and rinse thoroughly, and then pat dry. And then I'll do the same side And now I'm going to put the towel lengthwise, and then I will now going to wash the abdomen, Mrs. Smith abdomen. So using the wet clean cloth, I'm going to use to make a washcloth, mitt again, and then with soap I'm going to wash Mrs. Smith abdomen, and I make sure to wash it thoroughly and rinse it thoroughly and try them, and then I will make sure to check her skin condition, if there is any sign of pressure ulcers, if there is any redness, especially in the area under the breast and the skin folds, abdomen folds. And yeah, if I see any abnormalities, then I'll make sure to record and report it to supervisor. So now I already I finished washing Mrs. Smith abdomen and chest. Now I'm going to put pull the wash blanket up, and then I will take away the bath towel. Now I'm going to wash Mrs. Smith leg and feet. So starting at the feet or leg away from me, I'm going to uncover and making sure that I'll not expose other area which I'm not working with, especially the perineal area. I'm going to use a washcloth put under Mrs. Smith leg, and then with a clean washcloth I'm going to make a mitt again, and then I will wash Mrs. Smith leg using the long perm stroke, and then I will support my palm to her leg, and then I will do, at the same time I need to do my observation on her skin, any signs of pressure ulcer or any wound drainage or any swelling. And then after I wash her leg, I will rinse thoroughly and gently pat dry, and I will apply moisturizer if it is stated in the care plan. And then after that, I'm going to wash Mrs. Smith's feet. If I can see that her feet or foot is visibly soiled, I'll soak them in the basin with water for about 3 to 5 minutes, and I will use the orange stick to clean under nails, and I will use the nail file to file them smoothly. And after I do that, I will rinse thoroughly and gently dry them. And now the leg farthest from me is already clean. I will do on the opposite side, the nearest to me. I'll put the bath towel under her leg, and then I'll use a long perm stroke to wipe her or to clean her leg, and then I will do the observation of the condition of the skin, if there is any sign of pressure ulcer or weakness or swelling, and then I will make sure to report on record. And then after I rinse thoroughly and pat dry, I will apply the moisturizer as stated by the care plan, and then the same thing for the foot nearest to me. I'll soak it in the water in the basin with water for 3 to 5 minutes, and then I will use the orange stick to clean the nails, and then I use the nail file to smooth and file the nails. And then I'm going all done and clean, I'm going to cover Mrs. Smith's foot. And then now I'm going to um, help Mrs. Smith um, to to change in lateral position facing away from me. And then I'm going to wash her back using a washcloth. I'm going to wash her back using a long firm stroke from the back of her neck to the buttocks. And then after I'm washing them thoroughly, I rinse thoroughly and then pat dry them. And after I pat dry them, this is the time to help Mrs. Smith or give Mrs. Smith a back massage. So I will use the lotion, and I warm the lotion by rubbing my two hands, and then I'll start from the buttocks or the waist side, and then I'll use a gentle firm stroke from the buttocks to the shoulder, and then reverse from the shoulder to the buttocks, and I will do a massage for about 3 to 5 minutes. And if I see any redness on Mrs. Smith's skin, I will never massage because that will be can be the first stage of pressure ulcer. Then after I finish Mrs. Smith's massage, I'm going to put her back in a supine position, and then I will cover her with a wet blanket, and then I will proceed with the perineal care. But before that, I'll make sure to change the water and then check the water temperature. And now I'm going to raise the bed rail, and I'm going to change the water. I'll be right back. Now I'm going to do perineal care for Mrs. Smith. I already provided privacy by closing the door and the window, and then I also used the privacy curtain, and I already do my proper hand washing, and I also put on my gloves, and I make sure to follow the principle of DIPS in helping Mrs. Smith in cleaning, doing the perineal care. And now I'm going to start, but with a clean washcloth. I'm going to use a mitt, and then I will help Mrs. Smith clean her vulva by washing with a Periwash soap. I'll make sure to only expose the area which I'm working on now, is the vulva. So I'm going with using my left hand. I'm going to separate Mrs. Smith labia as apart as possible, and then using my clean mitt or washcloth, I'm going to clean first the labia away from me using the first stroke from top to bottom, and then for the second stroke using the other side of the cloth which is clean, I'm going to clean the labia close to me with a second stroke from top to bottom. And then for this third stroke, I'm going to clean Mrs. Smith center of the vulva to the perineum with just one stroke. And then if I see that still there's still visibly soiled, I can do the same steps for a few times to make sure that I wash them thoroughly. And then I will try them and and then I'll help Mrs. Smith to clean from her perineum to the anus. And I make sure that I clean it thoroughly, I rinse it thoroughly, and then I try them. And then after I finish washing her perineal area, I will take away the waterproof pads that I put earlier under her buttocks and under her butt, and then I will I'll let her bend her knee, and then I will help her. I'll take off the gloves and wash my hand, and then I help her put on her clean undergarments or underwear, and then her pants, and I make sure to put her blanket, make it wrinkle free, and then I place the cold bill within her reach, so she can call me anytime when she needed my help. And I lower the bed to the lowest position as stated by the care plan, and I'll raise the bed rail as stated by the care plan, and I wash my hand, and then I go out from Mrs. Smith's bed, room. Now I'm going to help Mr. Jones to clean his to do the prenatal care for Mr. Jones. I follow the principle of tips, and I already provided privacy by closing the door and the window, and also use the privacy curtains, and I do my proper hand washing for about 20 minutes, and I put on my gloves, and I already put the waterproof pad under Mrs. Smith's butt, and then now I'm going to start washing Mrs. Smith's penis. I'll make sure that I only expose the space, the area which I'm working with. So now I'm going to grab the penis, and if the penis is not circumcised, I will pull back the foreskin and check if there is the yellowish substance or the stigma that can cause infection, and try to clean it well. And then I will start cleaning from the tip of the penis or the urethral opening, and then using my hand I will hold it, and then using a mitt, I put the peri-wash soap, and then I start from the urethral opening, which is the cleanest part of the penis, and then I will work outward. So I will follow the principle of cleanest to dirtiest, and then if I see that his penis is visibly soiled, I will do the same process for a few times until it washed thoroughly, and then I will rinse the area and the scrotum and then I'll retract the foreskin, or I return the foreskin in the original position. And then I'll clean the finish up, and then with downward stroke, and then I rinse the area. And now I'm going to help Mr. Jones flex his knees, and then I'm going to clean well the scrotum, and then gently try them. And then using a fold blanket, I'm going to put downward in between his head and in between his leg, and then I will help Mr. Jones to clean his rectal area. And then after cleaning his rectal area, I'm going to rinse thoroughly and dry them, and then I will remove the waterproof pads, and then I will remove my gloves and discard, and then I'll do my proper hand washing. I'll do my hand hygiene, and then now I'm going to help Mr. Jones to put back his underpants and then his pants, and then I make sure to put back the blanket, make sure that it's wrinkle free, and then I'll put the full bill within reach, and I lower the bed to the lowest position as the care plan stated, and I will up the bed rail as the care plan stated, and I will wash my hands, and I will go out from Mr. Jones' room.